Two more health service providers here in the BVI have added their voice in support of the government's National Health Insurance NHI plan for all legal residents of the Virgin Islands. Dr. Goff Aletta, owner and primary dentist at Premier Dental, says Premier Dental is emphatically on board with NHI. Dr. Goff Alletta's comments about NHI from the perspective of a dentist came during a recent exclusive interview with JTV News.
The national registration process is ongoing. I don't know what is the status of it. One thing I've experienced in my office is that a lot of my patients are coming, rushing at me, wanting to know if I will be on board. Emphatically, I am on board. Emphatically, I am invested in it. Like I said, the reason why I'm invested in it is because all of us had a hand, when I say us, I mean the other dentists, in making this thing. It's not being imposed on anybody. We fashioned it so that it would work well for everybody.
Noting that NHI will provide health coverage for BVI residents from cradle to death, Dr. Goff Aletta says the advantages of NHI are numerous.
First is the universal coverage. Second is the coverage from cradle to death. That's not going on really right now. A lot of people who are employed, their employers may choose to give them dental benefits, or they may not to, or they may not. And people who obviously are unemployed do not have any benefits at all. So with this universal coverage, I think it's a great benefit to the whole country at large.
Meanwhile, General Practitioner at Pick Smith and BVI Health Services Authority, Dr. Holland Vantapool, says NHI is extremely important to the health and well-being of BVI residents.
Well, for one thing, we have a rapidly aging population that's requiring more and more advanced medical care, especially in the tertiary hospital setting. And of course, as we all know, tertiary hospital care is extremely expensive worldwide. And the demands are greater and greater every day. The cost is escalating daily, and the cost to go overseas is even greater. So we have to form a system in the British Virgin Islands where everyone could access care and without favor. So the NHI, I think, is the initial steps to providing this type of service to the community.
Dr. Holland Vantapool says he has seen firsthand cases where people who could not access health care because of financial struggles.
On the front line, as it were, I see patients, I see their struggles when they can't have major tests or important tests that they need done because of financial struggles. I've seen the guy that's been in hospital bed for 5 days because he couldn't afford to get a CT scan for a head injury, which he obviously needs to have a CT scan for. I've seen the person that struggled because insurance refused to honor their claims because of some technicality. Those type of things, are the things that we see all the time. We're on the front line, we handle and we understand, but as physicians, even if we order something and we can't get it done, then half of our ability to treat a patient is limited or curtailed. So we really need to look at what is available and what persons can get within the territory, yes. But if we don't have a system like this, we're not going to develop the healthcare system, or the onus wouldn't be on us to develop the healthcare system to its fullest. So the NHI gives the onus and puts the onus on government to make sure that the healthcare sector, at least on the public level, is improved tremendously. And I think that would be for the advantage of all.
The NHI plan is expected to take effect January 1st, 2016.